Thank you very much for inviting me to the Digital Health 2017 meeting. My name is Dianne Skiba, and I am from the University of Colorado. And today I'd like to bring you greetings from the International Medical Informatics Association Nursing Informatics Special Interest Group. What I'd like to present for you today is a bit of history of the Nursing Informatics Group over the last 40 years, and to tell you a little bit about our strategic goals that we are planning for the next 5 years in our organization. So if we start back to the beginning and look at the beginning of the International Medical Informatics Association, this really began during our data processing and automation phase of technology. This was in the 70s, where we started to see many healthcare organizations throughout the world beginning to use technology for data processing and automation. And particularly in nursing, it was really around nurse scheduling, public health, psychiatric nursing, and physiologic monitoring. During that phase, the early group that would eventually be called the International Medical Informatics Association put out a paper, a white paper in 1974, describing the levels of knowledge that people needed to have in the healthcare arena related to computers and data processing. As you can see, they expected that there would be some information management and some knowledge around general level of computer knowledge and databases. They also wanted healthcare professionals to begin to work with data sciences to create and design medical systems. And last, they were also promoting that there should be healthcare professionals who have specialized knowledge in computer science that allows one to really design systems. Now think back about that. That was many, many years ago. Then we ushered in the personal computer age, and we began to see that this is where nursing started to get more involved, that there were systems available to nurses and physicians in their offices that were related to personal computers. We had a lot of systems being developed for admission, discharge, and transfer, order entry, lab systems, some early nursing documentation systems, and there was the growth of the minimum nursing data set during this time frame. This is when the Nursing Informatics Group really began. It was called Nursing Working Group 8. And it really started to gain momentum and to begin to start with many country representatives being a part of this working group. One of the first tasks that the group worked with was looking at education and what they thought might be some requirements for nurses to know. Myself and my colleague Judy Ronald at that time had written a draft called Guidelines for Basic Computer Education in Nursing, and Judy was the United States representative to the working group. And she really worked on this program, on this task force, to come up with competencies. And I'll share a little bit of that with you. We also started to see the development of master's programs in the United States and in the UK. The task force really broke down competencies by type of nursing. So their first type was the practicing nurse. What did the practicing nurse need to know about technology? And so here is sort of the general categories for the competencies of a practice nurse. They also sort of flushed out the details of a nurse administrator and what the competencies were. Now you have to realize these were back in the 1980s, so it was very typical of what was the predominant themes in IT at that time. They also fleshed out ideas for the nurse educator and how the nurse educator needed to have competencies to be able to really use technology in the education and assessment of students in nursing. And last but not least, they also designed competencies for the nurse researcher. And as you can see, we were really talking about very much how to manage and manipulate data, how to begin to use different kinds of bibliographic services at that time. Then we usher in the internet era. And as the internet era came in, there was a huge growth in computer-based patient records. And you started to see this across many countries. You also saw the beginning of telemedicine, and people were using personal digital assistants, which are sort of our predecessors to our smartphones nowadays. Email and electronic bulletin boards and the web were starting to become popular. During this time frame, we saw a lot of different projects happening across the world in terms of nursing informatics. There was a lot going on with terminology development. You had the American Nursing Association recognized informatics as a clinical specialty and wrote scope and standards. There was the growth of nursing informatics programs worldwide. In Europe, they had the Nightingale Project, which was really to begin to integrate informatics into the nursing curriculum. There was the European Summer School Institute that they held every summer to help people understand more about clinical informatics as well as curriculum development. We saw the start of online education programs, and we, along with Duke University, were one of the first online educational programs. You also saw the major organizations like the American Medical Association and the International Informatics Association begin to develop a structure for core competencies. As we look to this area of the EHRs, we are really beginning to see that during this phase is when nursing really started to bloom and started to think about what kinds of competencies all nurses needed to have. It wasn't just focused on preparing the specialist. There was a push towards implementing EHRs and using web-based applications. There were a lot of articles like Staggart, Gassert, and Curran's article about competencies, and we had the rise of Tiger. Tiger is the technology and informatics guiding the education revolution. And that started out as a US-based project and is now an international project with people from around the world using the Tiger competencies. And again, you saw the shift from preparing healthcare professionals to work in the field to now ensuring that all nurses had the necessary nursing informatics competency skills. We are now entering that post-EHR era where we have started to implement these things, we've started to look at these things, but now we're moving into what I like to consider connected care. We are looking at how we use the Internet of Things, which are all our smartphones and sensors and monitoring equipment, and connect that with what I consider the high touch. Connections are all about making sure that providers can be connected to providers to ensure quality care, that providers can connect with patients, and also patients can connect with patients. which is the current era that we're in. So think of connected care as about connecting patients, families, caregivers to the person's health data and the collaborative team at the point of care. And the point of care right now doesn't have to just be in an institution. It goes beyond the walls of a healthcare institution because more and more people are becoming e-patients and using digital tools, mobile app, social media, patient portals, and generating personal generated health data that they're sharing with their healthcare providers. To this end, the Nursing Informatics held a conference in 2016 looking at e-health for all. And one of the things that is an outcome from the post-conference is they have put out a monograph that's freely available to anyone, and here's the website that you can go to, on forecasting informatics competencies for nurses in the future of connected health. It is an excellent resource, and as I said, freely available that everybody can go and look at it. It is targeted to not only educators and looking to how to put this in their curriculum, but also looking at clinicians and the kind of work that we may need to do in clinical settings to prepare our nurses who are working in those settings. The Nursing Informatics Group has now started to begin its strategic planning process. We are looking to project goals over the next 5 years. Those goals will correspond to the 4 major vision goals set by the International Medical Informatics Association. So we will be creating strategic goals related to advocacy that really champions the recognition and growth of informatics within countries and across countries. We are looking to promote cross-fertilization of informatics knowledge and skills, as I said, across both academic and professional groups, as well as across the globe. And we want to really look at how we can best serve our patients and increase health research. We also want to strengthen the opportunities for participation by all members of our group. This year we have instituted virtual meetings that we will be holding for our General Assembly meetings, as well as for working groups that we have in our organization. We are also looking at how we can bring academics and researchers together to exchange evidence and knowledge to prepare that next generation of researchers and healthcare professionals in the field of nursing informatics. We are extremely excited about being able to give you this overview presentation. And if you'd like to get in touch with me, I am the chair and this is my email address. And if you'd like to speak to your country representative, I'm sure that Saloni Tessari would be exquisitely happy to interact with you and to take your needs and help us create the strategic goals for the next 5 years of our nursing informatics community. Thank you so much, and I want to wish you the very best and congratulate you on the 2017 digital conference.